Hello, we are here in beautiful Beirut, Lebanon for the World Allergy Organization 2019 WIS Conference that's hosted by the World Allergy Organization and the Lebanese Society of Allergy and Immunology. We've been having meetings with wonderful new cutting-edge topics, and sharing some of that information with me today is Dr. Lanny Rosenwasser. And I have asked him to share with us some key messages from one of his presentations. Share with us what you will be telling us today.
I'm covering the issue of severe asthma from the pathophysiology and treatment points of view. And I'm very struck by how the use of biologicals has started to emerge in the treatment of severe asthma and a variety of other allergic diseases.
And if you can share with us, what is the most recent development in biologics for the treatment of asthma? Which particular products and who would they be used to treat?
We're starting to get an armamentarium of multiple biologics that approach different aspects of the asthmatic and allergic conditions. So we have omalizumab, which we've had for many years, that targets IgE and its receptors. We have a number of products that target eosinophils through two of them, mepolizumab and reslizumab, that block the ligand interleukin-5, and benralizumab that blocks the receptor for IL-5. And there's a newer material called dupilumab that has just been approved in the United States for an indication for asthma that alters the balance of the type 2 immunity and seems to be effective in trying to treat asthma, especially severe asthma.
And if you had to select one key message that would be a take-home, both for allergists and primary care physicians in this area, what would that be?
Well, the new agents are very complicated and expensive to use. And the one thing that I think is emerging is that we need to know which patients are likely to make the most precise response to these newer treatments. So I think there's a lot of information that'll be gathered over the next few years that'll help guide those kinds of decisions.
And a very important question is, for the patient, why is this important? What difference in their quality of life would such a drug make for a patient?
If the drug is effective, one would expect that they would have a much better quality of life, fewer exacerbations, perhaps less usage of some of the other general medications that are used in more severe asthma. So these drugs make a big difference potentially in the overall management of severe asthma.
And if you had to select the future research in this area over the next 2 years, where do you think it's headed?
Well, I think there are now even follow-on potential molecules that are altering type 2 immunity and altering IgE responses that are in the pipeline. So some of them may emerge as really important treatments in the next few years.
That's wonderful. Thank you very much, Lanny, for
Thank
being
you,
with
Dana.
us today.
My pleasure.
And for sharing with our World Allergy group of allergists just some of the newest information on biologics in the treatment of asthma.